Joining us this afternoon. I'm very excited to talk with you guys about really just being a doctor in our world today. It's actually very interesting, specifically this year. But I'm Dr. Anne Marie Visosky. I'm a head and neck surgeon at Kaiser West LA Hospital that's just on La Cienega and Overland, so not too far from your school. So I want to start today by just kind of giving you an overview about your path if you're interested in becoming a doctor, about kind of those initial steps. And then I'll tell you more about what I specifically do. But just for some general information right now, earlier this year, reports were showing there's about 1 million active physicians in the United States right now. A little over 500,000 are in some kind of specialty type of medicine, and just under 500,000 do primary care medicine. So when you first decide, let's say you're in medical school already, and one of the first, what I call branch points, is you have to figure out, well, what kind of person are you? What kind of field of medicine is going to fit what you're excited about or what you enjoy doing? And so I always consider your first branch point is, are you someone that's going to want to go into a medical field, or are you someone that's going to want to go into a surgical field? So that was one of the first things when I started, and I started getting introduced to different areas, and I said, oh yeah, I'm a surgeon. I want to be in the operating room. And so that kind of helps you guide kind of what areas you start looking at. So if you're someone who thinks, well, I like seeing patients in clinic, I'm going to be someone who's more in a medical type field, family medicine, internal medicine, and pediatrics are going to be your kind of generalized fields of medicine. And then for internal medicine, you may have a certain area of the body that you really have an interest in. So say the heart is what you really are interested in, and you may want to go on to become a cardiologist. Or if the stomach and intestines, and you want to still, even though you're in medicine, do a lot of procedures, you may want to go into gastroenterology. Nephrology works with the kidneys. Infectious disease right now, very, very popular. Everybody knows Dr. Fauci, our most well-known infectious disease doctor. So there's so many options, even within, say, you can start in general internal medicine and then want to become something more specialized, perhaps. If you're somebody who loves medicine and studying diseases and different things about the body, but you're not someone who necessarily wants to see patients, radiology, which deals with all of the imaging, or pathology, which deals with the tissue from biopsies and different surgeries, might be great professions for you. We need you. You're what we call the doctor's doctor, because we need the information you provide, but you're not necessarily someone seeing patients on a regular basis. One specialty I really didn't know about when I was in high school was physical and rehab medicine. Those are doctors that work very closely with physical therapists, with people who have different muscle issues, but they see the patients, do different types of injections. And then there's all kinds of other specialties: neurology, dealing with the brain, hematology and oncology with cancers. There's anesthesiologists that we work very closely with that put our patients to sleep in the operating room. Psychiatry, emergency medicine is a very popular specialty right now as well. And there's a newer specialty, urgentology, which are doctors that specifically work only in urgent care type settings. So there's so many options within the general medical fields. But then if you're at that branch point and you say, well, but I want to be a surgeon, then what's really great in medical school is you can start exploring and doing rotations with the different surgical specialties to give you an idea of, well, what kind of interest might you have in those areas. So even within general surgery, itself, there's people that later go on to specialize in certain areas. They may only want to do vascular surgery and work with the vessels, colorectal surgery, do a lot of colon cancer type stuff. You may want to do only cancer cases, so surgical oncology. If you're someone who loves like kind of carpentry work and putting things back together, orthopedics is great. You just can't mind, you know, getting calls in the middle of the night for the open compound fractures that need to be fixed right away. Then there's my specialty, which is otolaryngology and head and neck surgery. And I'll tell you a little bit more about that later and why I chose to go into that. Urology does everything with the kidneys and all the organs of the urinary system. Ophthalmologists operate strictly on the eye. Neurosurgery does a lot of complex brain type surgeries. And then I added obstetrics and gynecology in the surgical field. Sometimes people put it in the medical field, but really it's a great field if you want the overall care of women, because there's a lot of general care as well as a lot of surgical gynecology aspects of it too. And so there's a lot of choices also within the surgical fields once you have an interest in that area. So you've got your interest, you know this is what you want to do, then you need an idea, okay, well, how long is it going to take me to get there? So 4 years of college, well, for most people about 4 years. Medical school is 4 years. And then depending on what you choose as what you want to go into, the type of residency you do. So general medical fields usually are about 3 to 4 years, like general family medicine and internal medicine. And then if you decide you want to go into any of those special training fields that I mentioned, like cardiology or pulmonology, then you're looking at an additional 1 to 3 years. It kind of depends on the field. And then even within those, you can do more training. For the surgical fields, most of us were about 5 to 6 years. Some of them go up to 7 years because they'll have some research time in as well. And then if you want to even specialize beyond that, about another 1 to 3 years. So what I would say is, you know, you're 18 or so, you're going to college, you get out around 22, depending on which path you're looking at here, somewhere between about 31 and 35, you are ready to conquer the world and go practice your field. But it's a lot of great fun stuff and learning that goes along that way. Residency isn't all, you know, sitting in front of the books. There's a lot of hands-on stuff that goes with that. So people are always asking me when I've done different talks, well, how much am I going to make when I become this or that? This is just a little graph I put on here that was from a report earlier this month, but it really varies. It's going to depend on the specialty you choose, the area in the United States that you plan to practice, and the type of practice you plan to go into, if it's a group setting, academics, private practice kind of thing. But I would say on average, general pediatricians are probably on the lower spectrum of earning, and then surgeons, surgical subspecialty surgeons, and any medical field that has a lot of procedures would be on the higher end of things. So I mentioned like the types of practices. This is another thing that I probably didn't fully know, all the different areas that you could choose to practice in when I first started medical school. But, you know, private practice, we all know doctors that they're out there in a solo practice doing it on their own. It's probably not as common nowadays as it once was a few decades ago. A lot of people now are in a group practice type setting that might be all your specialty or a few different specialties that you work with. So if you're in a group with maybe 10 other ENTs, then you're splitting up the call and making those kind of issues that come a lot all on you when you're in private practice. So a group practice can be very popular. Then there's like what I'm in here at Kaiser, which is a large managed health group organization where we have all our own hospitals, our own insurance, and then all of us doctors specifically work for these hospitals. Hospital-based groups would be like, you may have heard of like the Mayo Clinic, and you can work strictly for a hospital itself. Academics is great. I loved teaching when I was in residency. So becoming attending in an academic setting means you get to practice your profession as well as often teach medical students and residents. And if you enjoy research, that's also a great area. And then a newer area is locum tenens, where a lot of areas in the US maybe are struggling and need more family medicine doctors or internists. And so you may work for a group that you love to travel, and you don't feel like you're held down to any one spot. So maybe for 3 months, you'll go live in a certain area and you'll practice there because they're in need of that kind of doctor. So that works really well for some people too. And I just wanted to bring up that, you know, medicine is a great field in terms of there's so many volunteer opportunities too that you can do with this profession. All the way from a very local thing for working in free clinics. I did a lot of free clinics when I was in medical school, and some in residency, and you can help in schools and shelters. Over the last few years, with all the hurricanes that have happened, there's been so many doctors that have donated their time doing that, which is great. And then internationally, I just added 2 here, Doctors Without Borders and Operation Smile, but there's so many small groups too. We have groups of doctors here at our hospital that every year go to the Philippines, and some go to South America and do very specialized surgical cases in those places. So it's also something to keep in mind. So now I'd like to switch gears a little bit and just talk to you about a little bit about what I do and what head and neck surgeons do. So I put this picture here because this is what we look like now on a daily basis with our double face masks and our face shields, and everything makes it a little bit different this year. But I practice general head and neck surgery. So I chose that because I love doing a mix of different types of surgeries. I see newborn babies to patients that are 100 years old. So that's fun that I get a full mix of people. But some people want to be much more specific in their what they do in head and neck surgery. And so we also have a number of type of fellowships you can choose to be very specific that are also very interesting. Like if you really enjoy facial plastics, you've got two courses. You can do big reconstructions for, like on here it says head and neck oncology. So there's doctors in my field that strictly do very, very large cancer type surgeries. But then that big wound has to be reconstructed somehow. And so the facial plastic surgeons will often come in and do big free flaps to fill in those big deficits. Or you can choose, hey, I like the cosmetic aspect. I want to go be a doctor in Beverly Hills and do rhinoplasties and facelifts. Neuro-otologists are great. They work in a very specialized area deep in the inner ear and take out tumors and work very closely with the neurosurgeons. Laryngologists deal strictly with the airway and the vocal cords. I do a lot of sinus surgery, but you can go on and get specialized in rhinology and skull-based surgery. So not only do you do sinus surgery, you do the very specialized sinus surgeries, which are tumors of the skull-based area. And then people who love pediatric surgery and all the general surgeries we do, but also want to do very specialized airway type surgeries, can do that as well. So there's all kinds of different areas. So what's kind of a typical week for a head and neck surgeon? I see a mix of patients in clinic, like I was in clinic this morning, and then about a day and a half during the week, I'm also in the operating room. I see new patients, do a lot of, I'm a specialty that has a lot of gadgets. So this is a picture, what's called a flexible laryngoscopy, where I was looking in someone's nose yesterday and looking down in her throat with this camera. And so those are the type of things they do in clinic. And then there's some chronic type issues where patients come in to have those things taken care of. And there's a lot of clinic type procedures as well, skin cancer, cyst removal, biopsies. I did a couple biopsies for lip issues this morning as well. And then the kind of surgeries I perform, that's the neat thing about ears, nose, and throat surgery is we've got a lot going on in a very small area. This picture is a little bit hard to see up at the top left-hand corner, which is what everyone in the room was seeing. But these are vocal cords here, and this young gentleman had growths on his vocal cords called papillomas. So this, my hand's on the little joystick of a laser, and I was lasering those papillomas off his vocal cords to help him improve his breathing and his voice quality. But with the ears, some of you or maybe some of your siblings have had to have ear tubes for chronic ear infections. We do those type of surgeries. In the nose, everyone knows somebody who's had a septoplasty because they can't breathe well, or any type of surgery, endoscopic sinus surgery. Throat, I'd say I do a lot of tonsillectomies. Some of you guys may have had tonsillectomies. And then a lot of neck surgeries, thyroid glands, parotids, lymph node resections. So there's a big mix of different things that we do. This was a picture on Monday. My partner was helping me do a surgery. The CT scan is what we call an axial cut. If you look on the, that's actually the left side because the patient's turned. You see that there's the grayishness and some white. I don't know if my pointer actually works for you guys, but you can see there's a mass on that left side, and I had biopsied it. It wasn't a cancer, but cosmetically he wasn't looking quite right. It was a lot of fullness on that left side of his face. So this is kind of the look of what an operating room looks like, and I removed that portion of his parotid glands so we can get rid of that mass. So I'm just going to show you a couple pictures of some standard type of surgeries. Endoscopic sinus surgery for nasal polyps is very common. You kind of on this left-hand area see these whitish things. They almost look like peeled grapes. Those are nasal polyps that often grow in people's nostrils and sinuses. There's a picture of one large one that came out of someone's nose on that blue towel. The next picture also shows some polyps. And the last one is your maxillary sinus is behind your left cheek, or behind each cheek. You have a maxillary sinus, and all that gunk that's in there is actually allergic fungal debris. So the picture under it is after I opened up that sinus and removed all of that for that patient. So he felt a lot better after. So these are kind of typical sinus type surgeries. These are vocal cord lesions. The top left, you can see a little cyst. That's the patient's left vocal cord, and right under it is actually after it's been removed in the operating room. And the lower left picture is an early vocal cord cancer. And then up on the right is a polyp that kind of had bled into, and then you can see where it's removed. And I'm going to show you part of a little video. Hopefully this is going to work. This is a patient, I showed you the picture where I put a camera in. So we're often looking at someone's vocal cords in clinic. And this picture is showing little cameras in the patient's nostril. Now we're at the back of the nose and going down the throat area. We see this structure here is called the epiglottis, and he's clearing his throat. He's got a little mucus there. And then you just past it, once he clears it, you can see his vocal cords. Now this left vocal cord is normal appearing, but the right one, you can see it's kind of red and full. That's actually scar tissue. He had had a surgery at the VA hospital for an odd growth that was there, and he's left with a little bit of scar tissue that I monitor just to make sure nothing more comes out of that. But that, now you're looking down into the airway, and right behind that airway is where when you swallow the food goes down. So we do a lot of those kind of scope exams in clinic. Oops. And this picture, I just think this is a really fun surgery that I do, so I wanted to share it with you guys. It's called an endoscopic Zinker's diverticulotomy. And this middle picture shows that sometimes, it usually happens as we get a lot older, the esophagus where your food goes down creates this pouch at the back, and it can collect saliva and food, and so sometimes it can get large enough to cause people problems. So up in this left-hand corner, you see all that white stuff. That's actually a bunch of saliva and mucus that has accumulated. And if you look over on the upper right, you see these two kind of whitish yellow things. Well, those are actually pills that got stuck in this lady's pouch. And I happen to know they at least sat there for about 3 months, because the GI doctors had put a scope down her and saw them, but they couldn't reach them to get them out. So she was kind of sick, and I had to make sure she got healthier before I could take her. And it took about 3 months to get her to the operating room. So that's a long time for those pills to sit there. But then over on the lower left, that's once I got the pills out, you see this bar of tissue, and that's the bar that has to be lasered open so that the pouch can no longer collect food and debris. So it's just a really fun surgery, because people feel dramatically better right after, and they don't feel things getting stuck in their throat anymore. So I just wanted to bring this up. A lot of people may not know this. You guys are going to have so many choices of so many great medical schools out there in the country. But Kaiser actually just opened a medical school right here in your backyard. It's over in Pasadena just this year. So it's really exciting for us. It's our first class this year. There's 50 students. And it's about half and half men and women. So I'm actually really excited, because some of those students will be here at our hospital over the years. So I'll get to work with some of them as well. So why should you guys go into medicine? Because really, I truly believe it's one of the coolest careers out there. We do a lot of fun, interesting things that, although they take a lot of training to get there, it's really a great feeling knowing that you're of this small population of people that could potentially do something to help someone else. But you really have to have a passion for it, because it takes a while to get there, and you really want to do it because you believe that you have something to give the population and to help out, and you really have the potential to make a lot of difference in people's lives. So you guys have any questions?
I have a question on your residence. Did you do a rotation in different departments?
Yeah, so in medical school is, nowadays medical school is a little bit different. When I trained, you did 2 years of sitting in classrooms, getting all of the teaching and book work, and then your 3rd year you went on rotations and you started getting introduced to all the different things, and then by 4th year you start picking the things that you're most interested in. Nowadays they've grouped it a lot where you might learn about the pulmonary system. So you'll be in class and you're learning about it, and then they don't wait until your 3rd year, maybe your 1st or 2nd year, and you're like, okay, you just learned about it. Now we're going to put you on a rotation with the pulmonary service, and you're going to go experience what they do when they take care of those patients. So, and then you'll have anatomy that you're learning about the organs. So they're trying to really give students a very broad aspect right from the beginning, so that they can really get a sense earlier on what they really might want to go into. When I did it, my 3rd year is when I would do different medical specialties and then go into the operating room, and that's when I decided, okay, I really want to do surgery. And then I started picking, going on ENT rotations or general surgery rotations and different things that you can kind of get a feel of what you might like.
Great. There's another class or question that came in. What majors would you recommend if someone was interested in pursuing surgery? And does it matter as far as undergrad? I've heard different things.
Yeah, that's actually a great question. So many people, such as myself included, like I was a biology major. I did an emphasis in microbiology. I thought, oh, I'm going to go into something medical. I'm going to do science. Well, it happened that that's what I was most interested in, but you don't have to. I was on the admissions committee when I was in medical school. and you read all these amazing applications from people that maybe they were a music major or a history major. They love that, and that's fine, and it makes you a very interesting person. You just have to also make sure you do all the prerequisites of all the science classes in order to apply to medical school. But you don't have to be a science major. I think some of my most interesting med school classmates had very broad majors, and I think it adds a lot. So if you're like me and science is just what you love, and it doesn't make you a bad candidate because you choose that pathway. But if you also have a heart for music and you go to a school that you want to major in music and you just happen to do all of your science classes, that still makes you a great candidate.
Oopsies. Sorry.
That's okay.
Sorry about that. There's another question came in about how waking up in the middle of the night for emergency surgery. Are you on call for a specific, or do they call, like if you have a patient, how often does that happen?
Yes, so that is a good question too. And that really helps dictate the kind of specialty you might want to go into. If you're someone who, if somebody tries to wake you up in the middle of the night, you are not going to get up, then you do not want to be a surgeon that has a specialty that has emergencies. Because in my field, like I take call a week at a time, about every month to 5 weeks, because there's 5 of us here. And it's hit or miss. Some weeks I'm not that busy during the middle of the night. Some weeks I get called in a lot. So the kind of emergencies I would come in for are airway emergencies. Like if someone can't breathe and they can't put a tube down or intubate the patient, and they're concerned that I'm going to have to do a stat trach, they usually call me sooner rather than later. For excessive bleeding, people can sometimes bleed really bad through the nostrils. I get called in for that, or for some kind of infection of the head and neck that might be worsening. Those are probably the 3 biggest things that I get called emergently in the middle of the night.
Okay, and another question, do you get scared performing surgeries?
I don't get scared. You know, a lot of times patients will say, oh, this is just routine to you, right? And I always say, you know, yes, the type of surgery I'm doing is a routine surgery, but no patient is routine. And so I think if you go into each surgery realizing this is a human being, you realize the gravity of the situation. Having said that, there are certain emergency surgeries, like when I've been called in because I realize, wow, if I don't get this person's airway, this person's gonna die. Yeah, it's kind of scary. You put that out of your head and you do the job you need to do. But then afterwards, you kind of step back and you say, wow, whew, that was a little scary situation. But you can't dwell on that, because in those emergency situations, you have to just put everything on, you know, in what you're doing.
Do you have any, oh, there's another question. Do you frequently collaborate with other types of doctors on your cases?
Yeah, you know, there's some cases depending, certain head and neck masses, say, can grow around the carotid artery. So we've worked sometimes with the vascular surgeons because I don't want to be in the carotid artery. I work around it, but I don't get in it. So we collaborate sometimes on those type of surgeries. And then sometimes we'll have patients, actually this coming Monday, I'm collaborating with one of the plastic surgeons who does a lot of cleft lip and palate surgeries. There's a baby that needs ear tubes, so I'll put the ear tubes in, and then they'll do the cleft palate portion of it. So yeah, there's a lot of collaboration that can happen with certain types of surgeries.
Do you have any kind of crazy or interesting stories that you want to share out?
Oh wow. Yeah, I've got all kinds of stories. So, you know, one thing, just from a clinic perspective that people don't realize, I don't do it as much here as my residency training was with Baylor in Houston, where it's a very moist environment. So there's a lot of cockroaches, but I've taken lots of cockroaches out of people's ears, both alive and dead. That haven't had one of those in a while, but I've taken lots of those out. I've taken so many different things out of kids' nostrils and ears. And then surgery-wise, I would say I had a patient in residency who actually was a refugee from another country. He flew in, got off the plane, came straight to, I actually put a picture, that was Ben Taub Hospital on one of my slides, came straight to the hospital and had a mass on the side of his face that was about the size of 3 babies' heads. And it was a very large parotid cancer or parotid tumor. And his surgery took 17 hours. So that was a lot of, it was very interesting. And that was probably the most aggressive surgery I've ever had to do.
That's kind of crazy. More questions are coming in. How many, so you talked about specialties when you're a surgeon.
Mm-hmm.
How many different specialties are there as far as performing surgeries?
Gosh, how many was on that slide? I tried to think of all of the main ones. There's probably around 8 or 9 main fields, and then like general surgery had all of those different specialties, because I think of like vascular and thoracic and colorectal as all kind of branches and off of general surgery. Probably once you start doing all the branches, there's probably somewhere between 15 and 20 different areas.
Okay. And then now, obviously, COVID-19 has been around for a while now. How has that impacted your field?
A lot. So, you know, I tried to show a couple pictures that I could end up talking about this. So like scoping someone. Prior to a year ago, we didn't wear all of this stuff to put a camera in someone's nose. Now, every patient I see in clinic, I have an N95 mask and a face shield. All of my colleagues that work in the ICU settings with all the COVID patients wear that. What I didn't show a picture of is now, like today, 2 of my ENT colleagues are doing a tracheostomy on a patient who had COVID and has been in the ICU for about 3 weeks, and they can't wean him off to get the tube out. So he needs a trach or the cut in his neck. So they're going to be wearing the huge PAPR system. You may have seen some on TV where we have a huge ventilation thing, and we do those cases with that kind of machine on us, so that we can make sure our air is fully purified, just because of their long history of having had COVID. So it's changed a lot this year, and I really feel for a specialty like ours, or like mine, excuse me, where I'm always in someone's face. I think it moving forward probably will always change a little bit, not to the degree we're at right now, but I think moving forward it's just going to have a new sense of what it's going to mean to be that close into, you know, someone's face if they're breathing on you.
Right. And then how can you mentally prepare yourself for seeing an overwhelming amount of blood?
Well, you know, that's a good question. And there are doctors out there that are like, I don't like blood. This isn't, you know, if you're someone that you could be a psychiatrist. That's not someone that's ever going to see blood. Now, unfortunately, to get through medical school and even potentially parts of residency, you might have to. So I think that would be, you'd really have to think about what kind of specialty and probably figure out ways not to be in surgery that have a lot of blood in them. I don't know if there's a way to fully get out of going to medical school and not seeing some blood.
Right, exactly. I don't know if you talked about this, but there was a question about balancing family life with your career. How many hours a week do you work? Does it fluctuate? I know you said emergency surgeries,
Yeah.
but about how many hours or how many hours a day do you work? And then
That's actually a great question, and I did not think to put that in one of my slides. So balancing family and career can be a little bit difficult. Choosing your specialty can help with that. If you choose something that maybe doesn't put you on call or you get called in, but then also that's one of the reasons I also put in the types of practice that are out there. So one of the things I actually had my daughter when I was a third year resident, so that made life really interesting. But I already had her when I was looking at what kind of practice I was going to be in. So, coming to Kaiser where I worked with a group, I'm not on call every night. I know my call a year in advance. So I'm with a great group of people. We trade things when we need to. If I want to try and make some event that one of my kids has and I'm supposed to be on call, someone will usually cover me during that time so I can do it. So it's a great setting for me because I feel like I can do as many things are possible. Do I make everything? No. But I would say that most people, if you're in some kind of working situation, it's hard to make every event. But if you choose the kind of area, or even specially, and even as a surgeon, if you choose the kind of practice that gives you some flexibility, it's very, very, very doable. Now, when I was in medical school, I went to UC San Francisco. There's a very famous transplant surgeon there. And I saw interviews that her daughter gave, and her daughter said, yeah, my mom was gone a lot, but if you choose to be a transplant surgeon, you're operating at any hour of the night. Your patients are sometimes the sickest of the sick patients, and so you have chosen something that's going to take up a major part of your life. So you think about all of that, and the truth is, even when you finish college, you may not know what the person you are in your early 20s, who you're going to be at 31 when you finish. But just there's so many options out there, and I think medicine has come so far than decades ago where there wasn't even that option. I would say for all of you, men and women, you can really have some work-life balance, and it takes a spouse or a partner who's willing to help out a little bit. So when I do get called away, but it's very doable.
Great. Well, I don't see any other questions. Does anybody else want to unmute yourself and ask a question to Dr. V? Anyone? All right. Well, thank you so much. We appreciate that. It was a lot of information to take in. But it sounds like it's a long haul, but it's a very rewarding career.
It is,
so.
And it's I'm very, very happy. And if any of the students who listen today or who have any questions, I can always email you a contact email if they have any questions or interests or want to learn anything further.
Okay, great. And then if there was a request by the teacher, Mr. White asked if we can get your presentation. You can just.
Oh, sure. I can email it to you. Sure.
Great. All right. Thank you so much, everybody. And I just wanted to say there are volunteer programs at hospitals right now. Because I do monitor. I know Kaiser. I work very closely with. We talked about it in volunteer services. And I think they are accepting applications right now. They're one of the very few that are.
Oh, really?
Because there's still people going to the hospital, but I know they keep the COVID patients very separate, and they take temperatures on the way in. So there are applications out there. You can email me if you want an application to volunteer at Kaiser. There is a KPS program at Kaiser that was excellent before COVID. It was like a 100-hour volunteer program from January to June, and they hired students to work as a paid intern in the summer.
Oh, great.
After that, so that was excellent. But UCLA Medical, Cedars-Sinai, Children's Hospital all have a volunteer program, but I have looked into it. Those are on hold right now. But again, Kaiser, I think, is one of the only ones I know of that are still accepting volunteers as of a month ago, when I talked to the volunteer services coordinator. So thank you so much.
All right. Thank you.
All right. Have a great day. Have a great day, everybody.
Bye-bye.
Bye.